I've got about 15 calls today because one particular hospital system in Atlanta has told their case managers not to send patients to Precious Hospice unless that patient stands on it almost that they really want to go to Precious Hospice. So this is what they've done. They've brought in an outside social worker case manager who's strictly for palliative care. And her only true job is to send all of the hospice referrals to their hospice company that they want to work with. One that you patients have said you do not like. They do not answer the phone in a timely manner. They do not sign you up within 4 hours. They are not home when you get home like Precious Hospice nurses are. They do not send you your medications in a timely manner. They do not send you an aide 5 days a week. They do not do what they're supposed to do. But I'm going to tell you all this because it's important. And I really need my black churches to stand up because your constituents are being treated poorly. And these hospitals cannot keep doing this to my people. It cannot keep happening. They're trying to block Precious Hospice because we do good work and I am transparent about the system. Listen to me again. They want to block me out. And the only reason how I know it's just me, let me tell you this. Let me tell you how I know it's me. For anyone saying it could be anybody, it's not anybody. Because these hospitals used to have a rotation. Once Precious Hospice started getting some of the business, we were never invited to the rotation. Let me be clear. And a rotation means this company gets some this week, this company gets some next week. We were never invited to the rotations. We were never invited to sit at that table. All of our patients come organically. We do not get invited to the table. Matter of fact, now they're being told to not send them to us unless the patient strictly says, send to Precious Hospice. Now, this is what they're going to do. And I told you this was going to happen, and it's happening now. They brought in an outside case manager just to do referrals to this specific hospice. So anytime someone says hospice from that doctor or anybody, they're not going to wait for you to say Precious Hospice now. Lord have mercy. I cannot make this stuff up. It's just like, if this was the problem before, why not do it before you had other companies in rotation? We never got the rotation call. We went around and we're just transparent with the community. And so because we built our business on being transparent, now you're trying to block us out even more. Case managers, I want you to be careful because your hospital is a nonprofit. If something goes bad, they're going to say, why did you send them to a bad company? Your licenses are going to be on the line, not the hospital.